Hello, I'm Monica Price and welcome to the show. On this week's show, I'm talking about all things homeopathy. I'll be interviewing some incredible doctors who have flown in around the world for the Faculty of Homeopathy Congress, which is being held in Edinburgh. And it's been fascinating. Myself as a nutritional therapist, I've learned so much about homeopathy being here for these 4 days, and I'd like to share some of the guests that I met. So stay with me and I'll take you on a little journey all about homeopathy. My first guest is Dr. Issac Mathai. Wonderful to have you here, thank you, who is the founder and the medical director of Soukya. I hope I've pronounced that right, yes. Which is a holistic health centre in India. So wonderful to see you, Issac. Really lovely. Thank you so much for joining me.
Thank you for the interest in the holistic healing and homeopathy. So very wonderful to be with you.
It really is. And we've just seen you because we're here at the faculty, the Faculty of Homeopathy, the Congress, the 100th Congress. And I saw your presentation this morning, and it was quite enlightening, actually, all that you do and, you know, the many years that you've been looking after so many people, thousands of people. What made you become a homeopath? How did it start for you?
My mother was practicing homeopathic medicine for 52 years in a small village in India. When she started, there was 60-kilometer radius, there was no other doctors. So she looked after 7 generations of people, 7 generations. So as a good profession, and I assisted her when I was a 10-year-old packing medicine and helping her because the clinic was in my home. So I got into homeopathy from the very young age. Mm-hmm. Then I went for a medical qualification to be a good homeopathic doctor. So that's the beginning of my homeopathic journey.
Wow. And it's been how many years now?
It is 40 years.
Wow.
I qualified 40 years ago.
That's a long time. And have you seen many changes with how people use homeopathic treatments?
There are different methodology in homeopathy in different parts of the world. Mm. But in India, we see a lot of acute cases. I started to learn more by seeing a lot of acute cases. I remember my mother with a 2-day-old baby sent away from the hospital because of gastroenteritis. And she's keeping that baby in her clinic, giving one homeopathic medicine every 15 minutes. And 4 hours time, the baby is fine. So that type of miracles I have seen in my life. There are hundreds.
And for myself as a nutritional therapist, and I'm CEO of Homeopathy UK, and I've seen it myself. And the more stories that I hear, some of them really are quite miraculous. They're life-changing to some people.
Yes.
And is that because obviously the critics will say it's just a placebo effect? What do you say when people criticise homeopathy?
We have hospitals, not only my private clinic or my charitable homeopathy clinic in the village were 150 villages near the city of Bangalore with a population of 150,000 population. We are giving free homeopathic medicine. They are uneducated people, poor people in the villages. They never heard about homeopathy. And with their many, many conditions, they come regularly and take homeopathic medicine and getting benefited. If somebody say that's a placebo and is water, I would say placebo can cure better than antibiotics. Why do you want to give antibiotics? Give placebo.
Yeah, that's a very good answer. And tell us about this lovely healing centre, your holistic health centre.
No, I started with the homeopathy, then I introduced yoga into it. And yoga can go with any healing methodology. Mm. Then from the homeopathic practice, and that's an essential element of our holistic healing centre, Soukya. Mm. But we incorporated naturopathy, therapeutic yoga, Ayurveda, which is India's ancient medical system, and acupuncture, and a healing in a natural environment. That environment itself is very good for healing. And in homeopathy, that's very important.
Yes.
The obstacles for cure, how to enhance your healing power, because it has to come from within. To have that within power, homeopathic medicine only stimulating that power, that is your healing power. So even a cardiologist doing a surgery, he's only doing the surgery, but healing power come from you, not from the hospital, not from the doctor. It has come from you. So that philosophy is very important to understand.
Yes, and I think more and more people are beginning to understand it, aren't they? They're now looking at alternative medicines, homeopathy and other complementary medicines. Would you say that we've seen an increase in that, probably in the UK or worldwide?
Yes, because I'm seeing patients now I have patients from 120 countries, and I regularly last 40 years seeing patients, homeopathic patients in America, in about 25 states in America and Europe. And this many countries, when I look at it, people are looking for other options. Those who believe in homeopathy, those who believe in other systems of medicine, that's one. But a lot of people that tried the Western medicine or non-curable, so-called non-curable complex medical condition. Majority of it is autoimmune diseases. That is a simple sneezing to lupus, to arthritis, any conditions like that. Homeopathy is a fantastic option and best methodology to use.
And we're now treating not just the acute conditions like coughs and colds and asthma and eczema, but the chronic conditions as well, aren't they? Tell me about a case perhaps where you've treated someone with a chronic condition.
We have patients flying in from all over the world. They've tried Western medicine for 20 years, 30 years. Like somebody's in a wheelchair recently came from America. She's 89-year-old. She has arthritis and many other autoimmune diseases. She has already taken 25 tablets. That age, nothing more can be done. She flew all the way, 24 hours flight, to come to our center, Soukya. And she stayed for more than a month. Within 14 days, she started to walk around. Within 30 days, she's gone for a shopping. And now after one year, she's coming back again to enhance. So the last 1 year, she can perform very well. Like that, even 18-year-old girl who has an autoimmune diseases, to 35 to 45 to 85. We treat all range of very chronic condition where they tried everything else in the planet Earth and coming, because with the homeopathy and lifestyle management and other systems of medicine and yoga, we can do miracles.
It is a kind of a unique package, isn't it? Complementary. It's what you say, you do yoga and meditation and things. Is that really important to you, Issac, that you have that kind of package, so it's not just one thing, the whole package is better for the patient?
I believe that. It is like lifestyle, eating habits, drinking proper water, environment, and the healing sanctuary where your life you learn to do all these things. You need a little bit of training. So people come and stay with us for 10 days to 14 days to 1 month. They will learn all this so they can go back and incorporate. It is very important for any methodology of medicine, the people's lifestyle, and they are taking responsibility for their own health and well-being is very, very important.
It is, and that's very key actually, because there's been a lot of topic about that in the news recently, about taking care of yourself, having responsibility for your own health. Stop blaming other people. And would you say, are we getting better at that? Would you say, are we taking care of ourselves?
Because of the advantage of now the Google and information highways, people are getting more and more information about what things to be done. And the research also in the best Western medical university like Harvard and everybody is doing research on how lifestyle and habits, even the media in UK also, they write huge articles about lifestyle modification. So my opinion, lifestyle modification with natural medicine, 80% of the condition can be treated. Only 20% of the conditions, surgical conditions, emergencies, that type of conditions only needed to focus on Western medical intervention. So it's cost effective, it's human oriented, it is life oriented, it is a healing oriented. So that's the approach we should promote.
Yes. And do you believe that homeopathy should work back into the NHS system here in the UK?
I would say that will be a huge positive impact on people, because we have done a study in a Western medical hospital. The cost of homeopathic treatment, including doctor's fee and everything together, will be 1/10 of the Western medical intervention.
1/10?
1/10. So if you use that, that's number one.
Yes.
Number two, you are enhancing a healing power. In my children, myself, all our life was taking homeopathic medicine. I have thousands of families I know, they are doing only that. If we can treat a condition with a simple methodology, with a simple natural medicine, whether somebody can call placebo or whatever they want to call. But if that's healing, then why can't you choose that rather than side effects and paracetamol and painkillers and all that. So I would say, give the option to the people, not by the government. Let the people decide which one they want to go to do, not by a medical establishment, as long as it's not doing any harm. And when a Western medical expert says there's placebo, I would say you should welcome that. If placebo can cure something, why do you want to give chemicals?
Yes, very true. Well, on that note, it's been an absolute pleasure. Thank you so much for joining me. Thank you.
Thank you. Thank you.
I'm now joined by Gary Smyth, who is the president of the Faculty of Homeopathy. Gary, thank you so much for joining me.
Thank you. Great to be here.
Oh, it's just amazing. What's it like for you being here in Edinburgh, snowing, and with all these wonderful people from all around the world?
It's fantastic, Monica. It really is fantastic. We're here for this 3.5-day event. We've got just under 300 people coming from 30 different countries, all with an interest in homeopathy and integrative medicine. And we're talking about integration, we're talking about sustainability issues, we're talking about how homeopathy fits in with the medical model and alongside conventional medical practice. Mm-hmm. And it is just lovely to be here. We've got medical doctors, we've got veterinary surgeons, we've got dentists, pharmacists.
Yes, that's it.
We've got lots of colleagues gathered together, and it's just lovely to be here.
Do you know, for a lot of people actually, Gary, not many people will think, oh, homeopathy for pets,
no.
Homeopathy for dentists.
No.
So tell us about that. I mean, it's not just for humans, is it?
It's not. It's for all species.
Yeah.
It's for all species. And we have a lot of members of the Faculty of Homeopathy who are veterinary surgeons and indeed veterinary nurses as well. And the veterinary surgeons are using homeopathy in an integrated way in their veterinary practice to treat large animals, small animals. All species really can benefit from the effects of homeopathy.
And what about dentists as well?
Yeah, I know. I don't know about you, but I don't like going to the dentist.
I don't. Anything they can do.
Anything can help. Yeah, anything that there is in the toolbox to help.
Yes. Bring it on.
We've got some great dentists, homeopathic dentists, using homeopathy to help alleviate that sort of feeling of anxiety and fear when you're in the dental chair, but also the after effects of the actual dental surgery.
Absolutely.
And indeed, trying to even minimize or reduce the amount of surgery required.
Yeah.
So, fascinating really to think about. And certainly in my role as a medical doctor, it's fantastic to have homeopathy available as an option in the toolkit for patients.
Yeah, absolutely. And what about you as a president, Gary? What is it? What does it mean to you to be a president?
It means everything. I've had a fantastic time as president. I've been president of the faculty now for the last 6 years. And it's been wonderful. It's been one of the best jobs in the world, I think. So it's been a great honor to lead this organization, not only through the pandemic, of course, but through ups and downs of life over the last 6 years. And it's wonderful now. Here we're in Edinburgh at one of our largest congresses for many, many years. We've had 100 of these congresses, and this is actually the largest one of them in recent years.
It's incredible, isn't it? When you actually say that, you know.
Yeah. And to see the organisation going from strength to strength and increasing in membership numbers is really, really nice. And just to witness medical doctors and these other healthcare professionals who are looking for something different. They're looking for something extra. They're not abandoning conventional medicine. Far from it. They're looking for an integrative approach. And they see homeopathy as something that's safe, low side effect, very low risk, in the right hands, very cost effective, and clinically effective for a range of different conditions. And they're interested in knowing more and starting to use it and learn about it and offer it to their patients. So it's wonderful to see that happening. Well,
I'm so pleased you could take the time. I know it's very busy. Take the time to come and talk to me. So thank you so much, Gary.
Thank you very much indeed. Thank you.
I'm delighted to be joined now by Helen Beaumont, who is the past president of the Faculty of Homeopathy. So welcome, Helen. Thank you so much for joining me.
No, thank you for inviting me.
It's just been so exciting, hasn't it, being here?
It has been incredible. This is the 100th Congress of the Faculty of Homeopathy, and I'm so proud to have been part of it and on its journey. I first started doing homeopathy in 1995. I'd been a general practitioner, and I enjoyed what I did, but I was very aware that there were many things that I wasn't really made to make a huge difference to. And I wanted to look for something where I could offer my patients something else in my toolbox. And homeopathy has been wonderful for that.
And have you seen some really good positive cases by using homeopathy?
Oh, incredible. Yeah. I started off thinking it was just going to be part of my homeopathic, my general practice. But actually, I was so impressed with what could be achieved and how patients found their own self-healing, and that I decided I would actually set up a private homeopathic practice as well.
Wow.
And to look after families, look after their children, see the mums, then perhaps see the grandmoms, see the dads.
It's a whole generation.
Whole generation. And look after those families for probably 20 years has been such a privilege.
That's incredible. So for those who don't know anything about homeopathy, just in simple terms, what is homeopathy? How does it work?
Well, homeopathy is treating like with like, similar with similars. And what we do is stimulate the body so the body can do its own self-healing, stimulating what we call the vital force. So it's almost like holding a mirror up so the body then knows how to treat.
It's a great way to describe it, actually. Yeah.
So then the body gets that stimulus and knows that this is out of sync. I'm going down this pathway and this isn't wrong. This is wrong. I'm not getting better. Oh, this is what we need to do. This is how I need to get back to centre. This is how I need to get this deep cure.
It's incredible, isn't it? And the power of homeopathy is just growing and growing. Do you think there's been an increase, Helen, in people using just maybe not homeopathy, but other alternative treatments as well? And
I think what was surprising for me when I first started training and I started introducing it to my patients in general practice, I didn't realise how much complementary medicine they were using. They weren't sharing that with me. And once I opened up and said, this is what I'm studying, would you like to try this? People said, oh yes, I've done this, or I went to see this person.
Really?
And so, but I think it's growing as well because it's getting more and more difficult to access NHS care.
Yes.
And actually people are realising we don't have all the answers. I mean, we do some amazing stuff. So if you had a bad road traffic accident or whatever, you would want to go to the best orthopaedic trauma centre.
Of course, yes.
But you would also want to have your arnica for your bruising and your bleeding. And you would want to have the aconite for the shock. And then later on, there would be other homeopathic medicines that would be appropriate.
Yes. Well, it's been incredible, isn't it? Being here, surrounded by so many different homeopathic doctors from around the world, which has been lovely.
Yeah.
Is there one thing that you're going to take from this Congress? This 100th Congress.
The 100th Congress.
Celebrating 180 years, isn't it?
Is the coming together of like-minded people to share in not just the knowledge, but the wisdom, that depth and breadth of knowledge, be it in research or in palliative care or looking after children and looking after animals is incredible. And for everybody to share their information. And the lectures have been superb, but actually the conversations over coffee are so important.
They're often the best ones, aren't they?
You learn so much.
Yes, absolutely.
And having headed up the faculty in the past and then been immediate past president, we've held a lot of this. Through COVID, we couldn't meet. And now for everybody to come together and meet, the buzz and the energy has been superb.
It's been lovely. Thank you so much for taking time to join me, Helen. Thank you.
No, thank you.
Thank you. I'm now joined by Dr. Elizabeth Thompson, who is an integrative medicine physician. Now, hello and welcome to the show.
Hello.
Elizabeth, let's first of all, that lovely word, integrative. So tell me, what does that actually mean for those who are watching who don't actually know what that means? What does it mean?
So integrative medicine is about how we put things together, conventional, lifestyle, holistic approaches, also something called functional medicine. There are lots of different ways to support people and putting it into one model rather than an either or. 4.
Yeah, that's a very good description, because it is a word, isn't it, that if you're not familiar in the health world, it's an odd word to use, isn't it? Now, for you as a physician, how long have you been doing this?
Well, that's the interesting thing, is that I didn't even know I was an integrative clinician because back in the day, I was a palliative physician, training in end-of-life care and supportive care, but I trained in a number of what we would now call integrative approaches.
Fantastic.
So things like hypnosis, neuro-linguistic programming, and for me, homeopathy, which became a real specialist interest. So then when I finished my training as a palliative physician, I took up a post in Bristol as a homeopathic consultant physician and worked at the Bristol Homeopathic Hospital for about 19 years.
Wow, that's a long time.
Yeah.
And I mean, did it bring you all the joy that you wanted it to? Was it something that you've always wanted to do? Or did you just, as you say, you kind of fell into it like this? But
I always wanted to be a doctor, but I realised that looking back, I was probably a healer. And so therefore I was always looking at something that would bring me depth and connection, and also allow some kind of deeper flow or connection. So homeopathy was just brilliant because I could really hear people's stories and allow them to express themselves.
I think that's right. I think because homeopathy is all about the uniqueness, isn't it, of the patient. Whereas if you go to a conventional doctor, obviously you've got 5 or 10 minutes per sort of GP visit. Whereas with a homeopath, they spend a lot of time, don't you? Perhaps just tell us what do you go through? What's the process for you, for someone who comes to visit you?
Yeah, so the process might look like a conventional medical appointment in that I want to know as much as I can about the problems someone might come with. And a lot of the time that is cancer, because I often say the devil's in the detail. If I can really understand what's going on clinically, then as the consultation moves forward, I can then understand difficult symptoms, I can understand emotional issues, and then even deeper things like dreams, what makes someone tick, that uniqueness, what we would call in homeopathy strange, rare, and peculiar. And of course, that brings a joy because everybody is different. I never get bored. I might get tired or a bit stressed, but I never get bored because each individual is unique.
And how do you see the future of homeopathy?
Well, I think the future of homeopathy is bright. We've been looking after it really carefully, and I think that within the integrative medicine model, it sits beautifully along a whole range of approaches like naturopathy, traditional Chinese medicine, nature connection, forest bathing, all of those things that relax us, allow us to open up, quieten the mind. But with homeopathy, it has come under criticism. But I think, if we can keep it safe until some of that real world data that we need that allows that usefulness to come into view, I think it's such an important medicine because I'll tell you why. I'm really interested in planetary health. I think we have a real challenge at the moment to look after the earth, which is a big complex system showing lots of distress. So here in Edinburgh, we've got -3 and then overnight we'll be at +11 overnight. It's just weird. So
it's crazy.
It's a bit like a human being where everything is out of balance.
I was just about to say, it feels like we're all out of balance, doesn't it? In the world and people. In fact, the whole world feels like it's a little bit out of balance.
I think we're all afraid, aren't we? And fear always puts us out of balance. But the lovely thing about homeopathy is it's very safe for the environment. It's not going to accumulate all those chemicals, those forever chemicals that, again, are polluting our waters and therefore polluting our bodies as well. So I just feel homeopathy is safe, it acts deeply, and if it can't do what's hoped for, then yes, use the technology, but have it as backup rather than first line.
Well, that's lovely. Thank you so much for joining me. It's been a delight. Thank you.
Thank you.
I'm now here with Dr. Lee Kayne, who's a pharmacist and a great-looking, wonderful, can I say?
Thank you very much.
Wonderful.
Thank you.
And of course, we're in Edinburgh, we're in lovely Scotland, so why would you not dress in your beautiful kilt?
Oh, it's always good to have an excuse to wear a kilt. Yes, absolutely.
So we're here at the Faculty Congress, Lee. So what's it like for you? What's it been like for you these 3 days, 4 days?
It's been fantastic. It's been so long since we've been able to get together.
Yes.
And we used to do it every 2 years, and we've not been able to do that for obvious reasons for many, many years.
Yes.
So it's lovely to see everyone and get back together, and it really shows you the difference of being face to face and being able to
It really
network
does, doesn't it?
Yeah.
It's the networking and, more things are,
Yeah.
quite a lot of my guests have said, it's been so lovely just catching up over coffee.
That's right.
The
That's
presentations have been fantastic, but just so
Yeah.
lovely just to catch up.
And it's so much nicer to see everyone in person
Yeah.
instead of a little box on a screen.
Absolutely. Now, tell us a little bit about what you do, because you have many hats.
I do have several hats.
Yes, so-
I'm a pharmacist,
Yes.
is my main hat, and I have a homeopathic pharmacy that I took over from my father, and we've been going 55 years, called Freeman's Pharmacy in Glasgow. I'm also a publisher of homeopathic books with Saltire Books, and one of my most important roles is that I'm the chairman of the Scottish Homeopathic Research and Education Trust, which is a bit of a mouthful, so we call it SHRED. Which everyone thinks is Shrek, but it's SHRED. And we're a charity that's been established in 1948.
Wow.
And we support people doing research in homeopathy, not just in Scotland, but all around the world. We support people who want to go and do courses and learn more about homeopathy. We supported 9 delegates to come to this Congress.
Wonderful.
And they applied with their CVs and what they hoped to achieve, and they were awarded funds to allow them to do that.
That must be so lovely, because it's kind of a next generation, is it, of homeopaths coming through?
That's right, and we're able to give back and encourage that. Another of the very important work that we do is in combination with Homeopathy UK, who are providing charity clinics throughout the UK, with I think 4 in Scotland currently.
Yes, that's right, yeah.
And we've been very honoured to partner with them to provide that and increase the accessibility of homeopathy in Scotland. We're very lucky because we have NHS homeopathy here still.
Yes. Hanging on.
That's right. But the HUK clinics are so helpful to be able to provide homeopathic access for people who want to have the treatment.
Well, and they're very popular. The clinics are just, there's a waiting list, they're always full. So that says a lot though, doesn't it? It says that people do want to try homeopathy.
Absolutely. The demand is definitely there. And people find that homeopathy helps them, particularly people who have other issues and other conditions and are taking a lot of medication, perhaps who can't take some other medications for new conditions, and people who just want a more natural way of looking after their healthcare.
Yeah, exactly. And well, it's been a short and sweet, but it was just wonderful to see you. And where are we off to now? It's the gala. We're going off to the ball now, shall we say?
We're going off to do some Scottish dancing.
Absolutely. I should look forward to it. Thank you so much,
My
Lee.
pleasure. Thanks for having me.
My next guest is Lisa Amerine, who is the president of the American Institute of Homeopathy. Lisa, thank you so much for joining me. It was wonderful to see you today, actually, on stage. Your presentation was it really was inspiring.
Thank you so much.
It was so good. What does it feel for you to be here? Is this your first time to the UK? A silly question, probably.
Well, no, it's only my second time to the
really?
UK.
Yeah.
And before, it was a very quick trip.
Yeah.
So it's lovely to be able to spend time here. And it's unreal for me. It's fantastic.
The welcome that you received, tell us a little bit about what you do, because obviously there's so many different people from all over the world that have congregated here for this wonderful, it's just 3 days of just love, really. There's so much love and joy in this room, and all things homeopathy, of course.
Yes.
But what's it like in America? Is it the same sort of situation as we have over here in the UK?
The situation in America can be up and down. For the most part, we're doing okay. It's not stellar, but it's better than it was, and it's got a long ways to go. And it's such an honor to be able to practice medicine there and have a practice that's exclusive in homeopathy and really help revive homeopathy in the United States, much like what's going on here.
And with your institute, how do they differ? Is it very similar to what we do here at the faculty and with Homeopathy UK?
Yes, it's very similar.
Yeah.
In fact, we were both founded on the same day, April 10th, 1844. So we share a birthday.
How incredible is that? That's great.
And so we're really similar. We actually have a memorandum of understanding that we work together. And really, as the world has gotten smaller with technology, we've teamed up to move forward doing a similar thing in the US that's happening in the UK. It's wonderful.
So how did you get into homeopathy? How did it all start for you?
Oh, I grew up with homeopathy. So my family physician was Dr. Nossaman, and he treated me from the time I was very young. And I loved homeopathy. When I was 10, if you needed arnica or hypericum or ledum, I was your girl. I
Was
gave
that,
it to
was that
you.
quite rare in America?
Very rare.
Because it's such a fun, we always think pharmaceutical. Whenever
To
we
me,
think
it
of-
was normal, but it
Yeah.
was very, if you needed that or calendula, there was no informed consent. I was the 10-year-old saying, here, do this, do this. And I've loved homeopathy. It's all I've ever wanted to do. And so it's what I'm doing.
And with obviously coming here, have you noticed the difference in how it is, perhaps in America? Would you say there is any difference?
You know, I think the difference, I don't know if there's that much of a difference. You know, both the UK and the US love homeopathy. They both strive to make it better. They both love the foundation that it's been set on. And so I think there's so many similarities that is just great to see.
Yeah, exactly. And for you and your family, you all use homeopathy, of course. And for you, what about the future of homeopathy? Do you feel that, you know, are we getting better at it? Do more people use it?
I think the future of homeopathy looks bright. And I think there's a lot of work to be done, but there's some great things that have happened in the past handful of years that have laid the foundation for us to really come together, which is something that has needed to happen in homeopathy for many, many, many years. And I see that happening, and I see us coming together, and I see the healthcare system really struggling, and that homeopathy is the future, is the way forward, and we're all coming together to make that happen.
Now, in America, of course, it is all about the pill. Every other advert on American TV is for a pharmaceutical, is for a drug. And more so now for preventative medicine as well, which was quite alarming, isn't it, when you see that? How do you feel about that? Is it, and is there a sort of is there a way in with the American government? I know now, obviously, you've got to have a new president coming soon. And regardless of how you feel about him, he is saying, let's make America healthy again.
Right.
How do you feel about that?
You know, I have a lot of hope, so much hope actually, that can really happen. And I hope that it's not just a dream, or in the States we call it a pipe dream, that you're chasing something. But I feel more confident and have more hope now than I've had in a very long time that some dramatic changes can happen, because right now the pharmaceutical industry owns everything. And as you said, the preventative side, the supplement side, or I will say green allopathy, is coming in strong second. And people have no idea what it's like. But I'm so hopeful with this new government, again, indifferent of people's views, but a major change that has to happen, and perhaps the time is now.
And do you think the American people will embrace that?
I think so. I think if you ask people independently, if you put it out there and you don't tie any political side to it, they're very, very excited. So I really think that once they start to see those changes, for the most part, the people, that's what they want to see.
And for you, is it beneficial for children? Or you had it when you was a child. Do you think we could do more for the children?
Oh my gosh, there's so much we could do for the children that helps them not only get over their acute illnesses or chronic illnesses that have developed because of their care, but then help them be healthy adults. And they don't get sick that much. And if they do, they recover well. And that was my experience as a child, and for sure that's my children's experience.
Well, thank you so much for joining me today. Thank you. I really appreciate it.
Thanks for having me.
Thank you. I'm now joined by Professor Aaron To, who is the founder of the Hong Kong Association of Homeopathy. Welcome to the show. Thank you. Thank you so much for joining me. Tell us a little bit about your organisation.
其實我哋個順勢療香港順勢療法醫學會咧係成立喺2005年嘅。咁當時咧，我哋就希望能夠好好咁樣喺我哋嘅中華地區咧，好咁樣推廣順勢療法。
Our association was founded in 2005, and at that time, the main purpose of setting up our association is to promote homeopathy in our location.
Wonderful. Is homeopathy popular in Hong Kong?
喺香港順勢療法普唔普及？
當初唔普及。
At the very beginning,
而家唔普及。
but now it is.
That's good.
係而家好多人都聽過順勢療法。
Now, majority of Hong Kong people has heard about homeopathy.
係我哋如果我哋根據我哋嘅統計啦，
According to the survey of our association,
香港每35個人就會有一個咧係嚟過我哋嘅地方度去求診於順勢療法。
Every 35 Hong Kong people, at least one of them has visited our center at least once.
That's incredible. That's very good. And is it different ages? All sorts of ages?
係咪唔同嘅年紀？
係唔同嘅年紀，有 BB， 有老人家，有年青人。
From the babies to the elderlies and also the youngsters.
Wonderful. And what's the difference that you've seen using homeopathy in your patients?
我係加咗順勢療法入去之後，你覺得你啲 patient 有啲咩轉變？
好多，即係好多問題都有改善嘅。譬如哪怕係糖尿病啦、高血壓啦，加入咗順勢療法之後咧，佢哋個副作用少咗啦，但係個效果好咗好多，身體亦都強健咗好多。
Their clinical outcomes generally improved, especially for the chronic diseases like diabetes, hypertension. With the addition of homeopathy, their clinical outcomes is better, and they also need less drug.
Yes, and is that obviously the goal, the aim is to have less drugs, less medication?
咁所以最後都係希望可以少啲藥物啊，少啲依賴。
係啊，我哋都希望能夠透過順勢療法減少病人對藥物嘅依賴咯，同埋因為藥物而引起嘅副作用。
Yes, by the addition of homeopathy, we sincerely hope that the dependence of medication would be decreased, and so that side effects that all this drug can cause would be minimized.
Yes. And where are you based in Hong Kong? Whereabouts in Hong Kong are you?
你喺香港喺邊度嘅？
我喺香港個地方，我哋香港係喺彌敦道太子地鐵站 E 出口。
Hong Kong is very small.
Yes,
actually,
I've been to Hong Kong.
yeah, right. But and then our location is in Prince Edward. Yeah, and it is like right at the center of Hong Kong.
Fantastic.
Yeah.
So do you find that people come to you? Are you recommended now? Have you got a reputation so people will come to you?
咁而家你喺香港嘅名聲係咪好好，所以啲人會就會直情嚟揾你？
我唔敢講我名聲好好啦，不過算係咁啦。
I would not say like I have a super good reputation, but I think I'm okay.
That's okay. Well, that's good.
但係我覺得主要係因為我哋能夠令到大部分嘅人嘅健康都有明顯嘅改善，所以佢哋就一個介紹一個咁過嚟咯。而且我亦都有有一啲叫 YouTube channel 去講解順勢療法，去推廣順勢療法，俾多啲人知道順勢療法係咩回事。
In the older days, it is mainly by the patient's referral that we got the new patients. But nowadays, because Professor To got a YouTube channel and he regularly has live education programs, and also we invite different guests to have interaction so that people would have more awareness.
Spread the word, as we say. Yeah, spread the word. And why did you do it? What was your incentive?
你咁樣做係你即係you mean do homeopathy?
Yes, yeah.
你加入順勢療法嘅嗰個原因啊，嗰個意義係咩咧？
其實最初我係讀開整全營養學。
At the very beginning, he mainly helped the patients through nutrition therapy as well.
但係我發現有好多嘅個案咧，唔能夠同一個即係同一個東西可以處理得到。
It also does help, but it is not like very applicable to all patients that he sees.
咁我就向我個教授經常詢問啦。
And at that time, he tried to ask the question like, how can we do better?
Yes.
佢可能覺得我煩。
And maybe the professor think that he always has asked so many questions.
佢淨話你與其咁，你不如去學順勢療法。
And then he referred him to homeopathy.
咁我後來我接觸咗順勢療法之後，
And then after he learned homeopathy,
我有嘅疑問係自然解開咗。
many of those questions that he had in his mind is solved.
因為順勢療法有一個原則 ，like kills like，係非常之令我好佩服。
The principle of like cures like is what he think it is a very good foundation of healing.
係啊，即係喺呢個世界上面，我接觸過好多唔同嘅醫學咧，佢好少有好似順勢療法咁有咁原則性。
There are actually many different complementary medicines that he has learned in his life, and it is homeopathy that really got a very single and well-founded principle that everybody can follow, and then we can have a very predictable outcome.
And it's the one that you love the most. Yes, that's it.
我係好喜歡 I love homeopathy.
Oh, that's great. And what's your dream? What would be your dream with your lovely organisation?
我希望能夠將順勢療法正正統統咁樣咧，係將佢一個標準化咁樣，去將佢正規咁樣去教育同埋推廣。我好希望有一日順勢療法能夠成為咗主流醫療嘅一部分。呢個係應該有。
So Hong Kong is very small, but what Erin wants to do is actually in general in our country, in China region.
To spread the word,
right?
yes.
And what he's doing now is to make what we call standardization of homeopathy in our country. And he hoped that by doing so, maybe in 5-10 years, homeopathy would not be like an alternative medicine.
Yes, alternative medicine.
Right. It should be something that really inside the mainstream.
And what does it feel for you to come to the UK and be here at this faculty?
咁你嚟到英國 faculty 你感覺點樣啊？
感覺係好好嘅，好可以同一班志同道合嘅朋友，一班同業界嘅精英一齊去交流咧，我都係一件開心嘅事嚟嘅。所以我哋每一次佢舉辦嘅時候，我哋都會飛過嚟。
He felt really excited every time when the faculty congress held, because it is where we can meet professional and high standard, like-minded person.
Yeah.
And in this kind of congress, it really juices him up, and that is why he looks forward to every congress that is organized.
Yeah, absolutely. Well, it's been an absolute pleasure. Thank you so much for joining me. Thank you. Thank you. I'm now joined by Dr. Marliese Symons, who is a doctor of chiropractic and a classical homeopath. Welcome. Thank you so much. Wonderful to see you, Marliese. And isn't it just fantastic to be here in Edinburgh?
It's absolutely amazing. Yeah. There's so much history of homeopathy in Edinburgh, so it is very special.
It gives you goosebumps, doesn't it, really, to be here? Yeah. And what's it been like for you these 4 days?
I mean, it's just wonderful to reconnect with people who you've known for 35 odd years, and we've all got one thing in common, and that is a passion for homeopathy and healing.
Yes, and it's so lovely to see so many like-minded homeopaths from all over the world. Have come from all over the world, haven't they? And has there been one particular sort of event that's kind of made you think, oh, I'm so glad I came? Or is it just all of it's been wonderful?
It's just all of it, honestly. My husband was saying before I came here, he said, you know, one day is just going to be better than next. You always come back from these conferences buzzing because you're reconnecting, you're reinvigorated and re-enthused about homeopathy as if you need to anyway. But
yes,
you know,
I know, but it's always good to see people, isn't it, who like the same as you. Exactly. Yeah. And for you as a homeopath, what changes have you seen? Have you seen changes in the years that you've been a homeopath?
I mean, lots of changes. I think one of the most significant changes has been the grassroots people who are using homeopathy. 35 odd years ago, people could barely pronounce the word.
Yes.
And now people are going to their GPs, they're going to their doctors and they're saying, you know, we would like something natural that is not going to give us side effects, that is safe, or, you know, I don't want my child to go on drugs. These are the kind of patients that I'm seeing.
Yes.
That people are coming to me and saying, I don't want my child on drugs, or I don't want to have that operation. Is there something we can do?
That's great though, isn't it? They're actually seeking alternative treatment.
Yeah.
And what's your feeling about it coming back into the NHS? Would you like to see that? A very silly question, of course.
I mean, I would love to see it come back into the NHS.
Do you think it will?
That's a really tricky question. I think the way doctors are being trained at the moment in the Western allopathic system, they are asking more questions about Western medicine and the harmful effects of drugs, and we're seeing huge rises in, for example, autoimmune disease.
Yes.
So they are asking questions, and I find that they are quite open to something that is natural, that works, and keeps their patients happy.
So how do you think we can resolve that? Could we introduce homeopathy perhaps into their training when you first become a doctor?
I mean, that would be brilliant, wouldn't it? First of all, it always starts with education.
Yes.
So let's educate everyone into knowing, understanding homeopathy, that it's a holistic system of medicine. We're not just looking at the physical body, but we're looking at the whole person.
And it's integrative, isn't it? That's the thing. I think probably you'll agree. With your practice, it's all about having the conventional medicine, but also having other alternative medicines.
Yeah, absolutely. And look, for some things, conventional medicine is always going to be better. Surgery, you can't really beat. There's some amazing things that have been done over the decades in terms of moving forward and what we can do, surgery, microsurgery, and that sort of thing. But chronic disease, Western medicine doesn't deal with very well. And something like homeopathy or any holistic medicine deals with chronic diseases really, really well.
Yeah.
And looking at cures, not just palliating people, just getting them on drugs and then them staying on drugs for years and years.
I think that's the thing about homeopathy, because that doesn't happen, does it? You treat that patient, and everyone's unique.
Yeah.
So because of that, the patient, I think, I don't know, recovers quicker, recovers better. What would you say?
Homeopathy looks to stimulate the natural healing process that we all have. So, when I treat a patient, I'm always looking for cure. It doesn't matter if they have a skin condition, a gastrointestinal condition, a neurological condition. I'm looking at 100% cure so that they don't stay on any medicine, whether it be homeopathy or any medicine. Or maybe the best we can do for that patient would be to come off drugs if that's appropriate. And it's not always appropriate. But it's about increasing their quality of life. And if we can do that, whether they're on drugs or not, then that's a win for the patient.
Absolutely. Well, thank you so much for joining me. It's
You're
been
welcome.
a pleasure. Thank you.
Thank you.